start another important topic today, which is actually chronic renal failure. Let's start. Bismillahirrahmanirrahim. Okay, so basically, when the patient is suffering from the kidney problem, he or she has a lot of manifestation of oral cavity. Basically, number one, uh, it is irreversible deterioration of the renal function. Means it is irreversible. You cannot reverse this failure. Basically, okay. Now, what happens? The plasma creatine levels exceed from 300 micromole per L. Okay, so the normal range is 80 to 120. Okay, but when it reaches to 1000, so dialysis is required in this process because there is so much creatine in them. Normal GFFR is 120 ml per mint measure renal function. Okay, the impairment in function of the kidney leads to a development of clinical syndrome of uremia. Means that in your urine there is blood. Okay, so in urine there is blood. Okay, now moving to oral manifestation. Now there are a number of oral manifestation. Number one, when the patient is not taking proper fluid, so it passes from xerostomia, infections of parotid gland, and uremic stomatitis, widespread oral ulceration, white plaques of oral mucosa. Okay, if treating properly, oral conditions can return to normal due to anemia. There is a paler color of mucosa, purpura, and hemorrhage due to deficiency of platelets. Oral candidiasis can also occur. Giant cell lesion of the jaws can also happen to this patient. It is due to hyperparathyroidism, okay, which is secondary to renal failures. Prolonged dialysis can give rise to oral lesion. Means when a patient is for a very long period on dialysis for a time, so the patient will have oral lesion, osteolytic lesion in bones. Means there will be some diseases that will occurring in the bone. Treatment is with the alpha hydroxylated vitamin D supplements to prevent the secondary hyperparathyroidism. Parathyroidism means you will give vitamin D supplements. Okay, so in order to prevent the secondary hyperparathyroidism. Okay, safe drugs used that are metabolized by liver, doses used means you have to give those drugs that can be metabolized by liver, and the dosage should be adjusted according to that patients. We study a lot of that those patients which have renal impairment, so the dosage adjustment are very important for those patients. Okay, now which I have told you: dry mouth, xerostomia, oral ulceration, plaques, bacteria, fungi plaques, failure of mucosa due to anemia, uremic stomatitis, giant cell lesions of the jaws, and also osteolytic lesions in the jaws. Okay, now basically when patient is undergoing dialysis, so basically when the kidney function is inadequate, they need dialysis. Means the kidney function is not properly. Okay, hemodialysis is actually a process where the blood of the patient is detoxifying by passing through the machine. Okay, then access to the patient circulation is achieved by arteriovenous unit on the forearms. Okay, it is very important. When the patient is kidney is not properly functioning, so the patient need to undergo dialysis. Number one, the what we have to do it for that, the access to the patient is circulation is achieved by arteriovenous unit. Then hyperonization parallel to the dialysis. Why you do this? In order to prevent the formation of coagulums. There is no clot formation in the blood and also during dialysis. Okay, dental extraction should be delayed because you have give the patient heparin, so there will be no coagulum formation. But if, of course, so when you do any dental procedure, there will be bleeding, and the bleeding will not stop, so the dental procedures should be delayed for 12 hours afterward, and the optimum time is should be 12 to 24 hours post hemodialysis. Antibiotics should prevent the infection. uh, Care must be taken when you prescribe any drugs. Okay, the dosage should be adjusted according to the patient. Screening for the hepatitis B and C. Okay, And then universal precautions for in order for cross infection control should be instituted for the all patients. Okay, what considerations you should be taken? Okay, so impaired excretion of the drugs by kidney. Okay, so you should not prescribe those drugs that can that have long excretion times. It should be easily metabolized by liver. Okay, bleeding tendency, you should care for the bleeding tendency, so you should do heparinization before dialysis. There also the patient is susceptible to infections due to IV shunts, so it should be clean. Anemia increase the carriage of hepatitis B and C due to patient is anemic. So for you should have proper screening for hepatitis B and C, hypertension. Then continuous ambulatory peritoneal dialysis does not need any hospitalization. Okay, these patients are hemodialyzed and not have any problem with EV shunts or heparinization, whether you don't know. But there is a risk of peritonitis also. There is a risk of inflammation of peritoneal cavity, so you should be careful in this. Okay, so for the when the patient has been has any renal disease, so the oral manifestations is xerostomia, uremic stomatitis, oral ulceration, infection of the parotid gland, paler mucosa due to anemia, oral candidiasis because of the platelet deficiency, and purpura and hemorrhages occur on it. Okay, and there is also giant cell lesions of the bone. Okay, then the treatment should be also according to that. You should for dialysis you should do first heparinization in order to prevent the anticoagulum. Okay, then you shouldn't do any dental extractions, should do give antibiotics for infections, careful while prescribing the drugs for hepatitis B and C screening, and you should do universal precautions to in order to prevent any cross infection. Okay.